Welcome to the Dr. Journal Club podcast, the show that goes under the hood of evidence-based integrative medicine. We review recent research articles, interview evidence-based medicine thought leaders, and discuss the challenges and opportunities of integrating evidence-based and integrative medicine. Continue your learning after the show at www.drjournalclub.com.
Please bear in mind that this is for educational and entertainment purposes only. Talk to your doctor before making any medical decisions, changes, etc. Everything we're talking about, that's to teach you guys stuff and have fun. We are not your doctors. Also, we would love to answer your specific questions. On drjournalclub.com, you can post questions and comments for specific videos, but go ahead and email us directly at josh@drjournalclub.com. That's josh@drjournalclub.com. Send us your listener questions and we will discuss it on our pod. Hello and welcome to another Dr. Journal Club Super Speedy Summary. This one is on a very excellent clinical practice guideline that just came out in the BMJ by a really stellar research group. Bousset has done some incredible work with chronic pain, really cutting-edge methodology, and he was attached himself with the Guyot group at McMaster, just a sort of a superstar lineup of methodologists and researchers on this study and really useful practice guide. So the problem, of course, is chronic pain, of course, is extremely common. People are using medical cannabis, especially these days as more and more states in the United States are legalizing it, but the current clinical practice recommendations are inconsistent. So the question for this guideline was, what is the role of medical cannabis or cannabinoids for people living with chronic pain due to cancer or non-cancer causes? So again, this was a clinical practice guideline. It was based on 4 really excellent systematic reviews with state-of-the-art methodology. They built an international guideline development panel, including patients, clinicians with content expertise, and methodologists. And of course, they used the GRADE approach, which is really the standard now, and they framed everything within an individual patient perspective, which I think is excellent, but as opposed to sort of a societal perspective. And there can be different conclusions based on your perspective, but that's what the perspective that they took. And their summary was they offered a weak recommendation to offer a trial of non-inhaled medical cannabis or cannabinoids in addition to standard of care and standard management if it's not sufficient. So in other words, you do standard of care for the chronic pain. If that's not sufficient, the clinician can offer a trial of medical cannabis for people living with chronic cancer or non-cancer pain. And it was a weak recommendation not because the quality of the evidence was particularly low. There's actually surprisingly high level of evidence on a lot of the aspects here, but it was a weak recommendation because the actual magnitude of effect was, at least to me, somewhat surprisingly small. So they had pretty decent evidence, but that it was effective, but that the effect was quite small, and for that reason, they made a weak recommendation. Dr. Jamie Caroon, our expert in CBD and cannabis methodology, goes into great detail on this paper in both a basic and also in-depth level video we have on this, so go ahead and please watch his more detailed explanations as well.
If you enjoy this podcast, chances are that one of your colleagues and friends probably would as well. Please do us a favor and let them know about the podcast. And if you have a little bit of extra time, even just a few seconds, if you could rate us and review us on Apple Podcast or any other distributor, it would be greatly appreciated. It would mean a lot to us and help get the word out to other people that would really enjoy our content. Thank you. Hey, y'all, this is Josh. We talked about some really interesting stuff today. I think one of the things we're going to do that's relevant, there is a course we have on Dr. Journal Club called the EBM Boot Camp that's really meant for clinicians to sort of help them understand how to critically evaluate the literature, et cetera, et cetera. Some of the things that we've been talking about today. Go ahead and check out the show notes link. We're going to link to it directly. I think it might be of interest. Don't forget to follow us on social and interact with us on social media. At Dr. Journal Club, Dr. Journal Club on Twitter. We're on Facebook, we're on LinkedIn, et cetera, et cetera. So please reach out to us. We always love to talk to our fans and our listeners. If you have any specific questions you'd like to ask us about research, evidence, being a clinician, et cetera, don't hesitate to ask. And then, of course, if you have any topics that you'd like us to cover on the pod, please let us know as well.
Thank you for listening to the Doctor Journal Club podcast, the show that goes under the hood of evidence-based integrative medicine. We review recent research articles, interview evidence-based medicine thought leaders, and discuss the challenges and opportunities of integrating evidence-based and integrative medicine. Be sure to visit www.drjournalclub.com to learn more.